So welcome everybody. My name is Deborah Levin. I'm the president and CEO of the Center for Health Design. There are a lot of new faces to me in this audience, so for me that's very exciting. After 2 decades of doing this work, I feel like every time we have a gathering and a meeting, it's camp because you see so many of the same people. But I'm excited by this audience and the diversity of the crowd that we've been able to bring together for this conversation. So I have the pleasure of introducing and starting off the morning. The first thing I want to do is I really want to thank our partners. This was a huge undertaking to pull this together, and we are here today because of the generosity of Virtua. I'm working on 2 computers, excuse me. We're here today because of the generosity of Virtua, which was one of our Pebble projects. So for me, this is exciting to see this facility as it's up and running, and for us to really use it as a jumping off point for this conversation, because they've done a lot of work in this area. So I really want to thank you and thank Tejas and the whole group of people here at Virtua for hosting us and for making this available and for making all this technology available so that we can capture this and really have it for the future. Also, I'd like to thank our advisory group. If you're here in the audience, if you could stand up. This really was a huge undertaking. So Eileen, Don, John, Tejas, Jen, if you're here, if you could stand up and just let us thank you for all the work you've done. And I'd also like to thank the staff of the Center for Health Design. I know Ellen and Angela are in the room if you want to stand up and say hello. And then Matt, who is running around furiously making sure that all the pieces fall into place. So if you could just give him an attaboy, it's just amazing. So why are we even having this program, and why did we look to our friends at AHRQ for this funding? If you look back about a decade ago at the Institute of Medicine Errors report, we found that between 50 and 100,000 people were dying a year because of medical errors, and 2 million people a year were acquiring hospital-acquired infections. Almost 100,000 of them were dying each year. And there was a 20% turnover in our nursing staff. So now if you fast forward a decade, we find that still to this day that there are 25 harms per 100 admissions in a hospital, and 13.5% of Medicare patients experience some sort of an adverse effect, and that same number of Medicare patients experience some sort of temporary harm. So in a decade, we've really had basically no significant improvement in spite of all of the work that we're doing. And so what's so shocking about this is that when we looked at the figures, and we were so blindsided by that number of 100,000 unnecessary deaths, that what really happened was we drowned out the primary message, which is that it's really about the systems that aren't working, that our docs and our nurses are doing an amazing job keeping up with the technological changes and all that's happening in the industry, but the errors that happen, errors are just a part of what happens in everyday life, but they could have been prevented, they could have been mitigated by how we design our environments. And so that's really what we're here to talk about today, and that is, what can we build into our environments that really can help support the caregivers that are working to give the best possible care, so that the environment isn't actually an hindrance, but is actually helping to support. So I'm going to turn it over to Angela Joseph, who is our Director of Research, to really start to talk about how we're going to lay out today and how the 2 days are really hopefully going to set up an agenda for us in the future to really look at this and see how we can tackle some of these things. So thank you for being here.
Hello everyone. I'd like to welcome you all. I've talked to several of you on the phone and exchanged emails. It's really exciting to see you all here. So thank you for coming. So Deborah set the stage for why we're here and what we're trying to do. And just wanted to draw your attention to this model based on James Reason's work, where he talks about latent conditions in health systems as well as active failures. And what we're all familiar with is the number of falls, the number of medical errors, infections, things that happen down the stream. and often it's the clinicians or the providers who take blame for what happens. But I think what this model begins to show you is that those adverse events do happen, but they're often a consequence of things that are built into the system. The healthcare system itself has a lot of weaknesses and holes in it that result in these adverse events. And these are called latent conditions. And you see tools and technology, teams, guidelines, organizational culture, physical environment. All these are parts of the system, and it has a lot of safeguards in the system to prevent adverse events from happening. But sometimes negative or undesirable conditions are built into the system, often during the design process, that result in active failures happening. So that's where we come into the picture, because we are the people who are responsible for building these systems, including the physical environment. So the idea is that in this particular conference, we can talk about the design process itself and what is happening in the design process that results in these failures happening. And that's the key reason that brings us here. Many of you in this group are from the Facilities Guidelines Institute, Guidelines for Design and Construction of Healthcare Facilities. But for those who are unfamiliar with it, we will be talking about it in quite a bit of detail later today. But this guidelines, these are the guidelines that are used in 42 states across the US for building and constructing new healthcare facilities. And it is the most widely used healthcare design resource in the country. So it is something that gets to a wide range of people around the country, in all parts of the country. And what's exciting is that in 2010, there's a small section that was included in the guidelines around patient safety risk assessment. And it's just a small appendix. It begins to just put the word out there, but it doesn't give any instructions on how to do a patient safety risk assessment, or who should do it, or what should be done, which results in a lot of confusion, and people are not quite clear how to move forward, even if they want to. So the purpose of this meeting is really to begin to think about what is the patient safety risk assessment, what should the structure be, who should be involved, what are the kind of activities that might take place, and provide more structure so that people can actually go ahead and do a patient safety risk assessment. So these are some of the goals of this meeting. We've shared them with you over the various calls that we've had. But a key goal is to have a sense of, from this group, what a patient safety risk assessment might be, what might it involve, who are the people who might be involved, how does it link with other things that are already in the guidelines. We'll talk about that today. And also to create a summary of multidisciplinary patient safety practices. That's one of the most exciting, sorry, can you not hear the back of the room? One of the most exciting things about this meeting is that it's a very multidisciplinary group, people who bring different perspectives. So we're hoping to learn from this group to see from their perspectives what really works, and to pull that together to help inform the guidelines, and to develop recommendations regarding specific safety-related tools that we'll be looking at. So before we start with the day's events, this is the agenda for the day, and you have that in your meeting books. But in general, the agenda is structured so that in the morning we have we're going to have some presentations. Then we're going to have a tour of Virtua. Some of the team members from Virtua are going to talk about the work they've done in the last several years to build this facility, and then we'll attend the tours, have lunch, and then there will be a panel discussion followed by the keynote. And then there's a reception after that, which I hope you'll all stay for. And then those staying at the hotel will go back to the hotel.